Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Backache. Backache during pregnancy. This is one of the commonest symptoms which is troubling and torturing a pregnant woman through the course of pregnancy. And they keep coming back and claiming that if I would have known, I would have not gone through the pregnancy, etc. etc. Well, let me explain you what this backache is all about, why does this happen, and what are the quick tips that can help you to overcome this problem during the course of pregnancy. Remember, with every good thing, there is something which comes which you feel is bad, but actually it is a mechanism which has been created to help you have the good thing. What am I talking about? During the course of pregnancy, as the baby is growing and the baby's weight is growing, there are factors which are changing in the body. First and foremost thing is the common sense, which tells us that your weight is increasing and your baby's weight is increasing. So your body was not used to carrying so much of weight, and hence you're going to get this weight causing problem to you, and all that strain is coming on your spine and the back, and that is one of the factors which causes you trouble. Second factor is that the shift of center of gravity. All the weight is coming in the anterior part or the front part of your body, and to control that, the body tries to arch itself in the back and tries to shift the center of gravity. And this shift in the center of gravity is done because of the arching of the back, which in itself causes a lot of pain. Next important thing is that there are these hormonal changes happening in the body. So the hormone, like a relaxin hormone, which is created to cause laxity of the ligaments in the joints. Now this is Mother Nature's trick to give you that extra few millimeters at the time of delivery in your pelvis for the baby to pass on smoothly and come out without any problem. But in that bargain, when the ligaments become lax, so the joint-to-joint mobility is a little more, and that leads to a little bit of discomfort and pain. So very common thing to happen is the pelvic girdle pain or the backache, etc. Now, there's another factor. The next factor is calcium metabolism is getting a little haywire. So your vitamin D deficiency or calcium deficiency or improper use of calcium supplements or not having appropriate calcium in your diet can also impact your joint pains and back pains and etc. So you need to work on those vitamin D supplements or calcium, depending on your doctor's advice, of course, and decide on how to go about with that. Now, besides these various factors, there is one important thing is the posture. Sometimes, because our body is not used to this change in the shape and everything, you land up taking wrong postures, whether you're working, whether you're sitting, whether you're sleeping, and that is another cause of pain or difficulty during the course of pregnancy. Now let us quickly run through the tips that you can follow to reduce this pain or overcome this pain. The first and foremost tip is take care of your posture. When you're sitting, use some support behind your back. Don't stand for long hours. If you're standing for long hours, by default you're going to have a lot of pain. When you're feeding your child after delivery, that time also choose the posture which are right for your back, otherwise it causes a lot of pain. For example, a simple rule, remember the formula: bring the baby to the breast, not the breast to the baby. This will reduce a lot of backache. Now, next important thing is your sleeping posture. Don't try to sleep flat. It is not just for your back's sake, but also for your baby's sake, because baby doesn't get good blood supply if you're sleeping flat. So you need to sleep on one side, especially in the second half of the pregnancy, and that will also take away a lot of load from your back. You can also take something called as a back massage or a back rub and all these things, which really helps you. It makes you feel very soothing. Remember, the sensations which are carrying your touch or the temperature are thicker than the pain carrying nerves, and that is the reason if you get a little touch on your back or you get a little gentle massage on your back, it feels good, even if it is done by an amateur like your husband. Okay, trust me, it is better to have it from him rather than anybody else. Next important thing is use of hot and cold compresses. These can also help. This is the temperature thing, how the temperature change on that surface masks the pain feeling, and that is how you feel a little better off. If it still doesn't come by, then you can use tips like, for example, use of any local analgesic gel or a similar such thing, which is a ibuprofen in the local area, but don't use it in large quantity because it causes a lot of burning and it will also cause a lot of rash if it is not taken appropriately. If it still doesn't come by, then you need to take help from your physiotherapist or your pregnancy exercise specialist, who will advise you and help you to strengthen your muscles and ligaments of your back, which will relieve you of the pain, because a lot of weight is being carried in front, and to cover it up, your back is supporting it. Add to that the vertical longitudinal muscles, the recti muscles on the anterior abdominal wall, may also give way, and that leads to more difficulty on the back spinous muscles and the paraspinous muscles, which are overloaded. All these leads to spasm and contracture, and that can be relieved with the help of exercises, with the help from professional physiotherapist. If nothing else works, please go to your doctor. They will be in a position to help you instead of taking unnecessary analgesic pills and popping them up without asking your doctor. Lastly, use appropriate dress, appropriate footwear, which is also very important to relieve you of your backache. No high heels anymore, madam. And these are the things which you follow. You will be relieved much better. Trust me, this is only temporary. If you take care of your body and your health and your posture and your muscle strength, it is just going to go away once a baby comes, right? And at the time of labor, if it really troubles you, you have a lot more options available to you. Thank you very much.